Conjunctivitis. To know what conjunctivitis is, you have to understand first what causes conjunctivitis. This can be caused by three factors. One is infections like a cold or bacterial or viral kind, for the matter affecting the left or right eye. It's important to know conjunctivitis can be contagious as well due to its viral nature. Another cause is also allergy, caused by allergic reactions from the eye being exposed to foreign objects like pollen. Thirdly, conjunctivitis can also be a result of irritation in the eyes caused by hairs or foreign objects entering the eye's lens. As a parent or caregiver, key areas to know if your child has conjunctivitis is that the eyes water a lot, eyelids are sticking with a pus-like discharge. The child's eyes are turning reddish pink due to inflammation, and if they feel the eyes are really itchy. What's the worst thing that would happen if you leave the child's eye untreated? Untreated conjunctivitis can transfer to the other eye or even transfer to other people. Conjunctivitis untreated is also seen as a symptom of other transferable diseases like trachoma, chlamydia, and gonorrhea, which can be caused by bacterial infection. It's important to know that around 40 million people live in areas where trachoma is contractable. Trachoma can be a severe type of bacterial infection due to its potential to lead to blindness for the patient. Trachoma causes scars on eye tissues, including the eyelids, conjunctiva, and cornea. So it's important to treat in early stages, as conjunctivitis can be an early onset symptom. Depending on the severity of conjunctivitis, if it is minor and left throughout the season, reduced depending on the pollen or if it's an allergic or bacterial infection. This is mainly due to the tears that have certain chemicals that fight off pink eye. This can also cause excessive tears or crying. Taking an evidence-based approach. Now the question arises, how do you go about treating conjunctivitis? Well, there are a few options available from least to most expensive methods for the child. Basic allergic conjunctivitis can simply be undone by not rubbing your eyes. Application of eye drops or if your contacts removed can cause irritation on the eyes. Milder forms of conjunctivitis can take pharmaceutical antihistamines to help with symptoms, which have the ability to sit at pharmacies due to being tested at Type 1 evidence studies through multiple systematic randomized controlled trials, or RCTs. Antihistamines are moreover so recommended over immunotherapy as they are not only less costly but also less tiresome, as immunotherapy requires consistent treatment for immunization. A more expensive approach would be to follow the practice of immunotherapy, which aims to improve the body's immunity to irritants that cause reactions. Immunotherapy can be done through injection through a nasal cavity or under the tongue. It appears, according to a study done in 2011, sublingual immunotherapy is effective in minimizing symptoms to allergic conjunctivitis. Taking an evidence-based approach, it's unlikely to recommend immunotherapy due to a medium to moderate level of evidence. It causes statistical heterogeneity, meaning different geographical backgrounds could have an impact on the patient responding to the treatment that the study didn't account for. The study clarifies the publication bias has occurred as the level of evidence isn't high enough for implementing into medical practices with certainty. The type of medical professional to help with the treatment of conjunctivitis. So who are where to consult for treatment? In order to prevent and treat conjunctivitis for child, it's advised to visit your local or family GP. In order to identify symptoms for treatment of conjunctivitis, GPs generally use blue lights and special dyes to inspect the surface of the eye through a method of fluorescent examination. If the infective conjunctivitis exists, GPs will swab your eye and send it for a lab test. The severity of conjunctivitis is most serious. GP might refer you to an eye specialist or an ophthalmologist. As if it was contagious or viral, it's important to visit one for quick treatment. In the case of bacterial conjunctivitis, antibiotic eye drops can be purchased from local pharmacies or eye ointments, for that matter without requirement of prescription, therefore waiving the doctor's visitation fee. It's important to know antihistamines medicines are available for pharmacies via a doctor's prescription. Thank you for listening.